Good afternoon, ladies and gentlemen. Thank you for being here with us today. We are going to start our health talk in a short while. Please share our live talk with your friends and family so that we can reach out more people to create the awareness on breast cancer. Hello everyone, I'm Vino, dietitian from Hospital Lamoai and your host for today. Welcome to our second session of our Breast Cancer Awareness Month Health Talk. Thank you once again for being here with us today. We are most honored to have our physiotherapist, Ms. Wong Sien Fui, and senior dietitian, Ms. Yon Pek Ling, as our speakers today. Before we start, please be informed that there will be 10 minutes of Q&A session at the end of each speaker's talk. So if you have any question, you may post it at the comment section below so that we will discuss on the question later after the talk. Without further ado, let me introduce our first speaker, Ms. Wong Sien Fui. Ms. Wong graduated with a diploma in physiotherapy from Masa University. She is a registered physiotherapist under Malaysia Physiotherapy Association. Ms. Wong has 7 years of experiences working in this field and currently working as physiotherapist in Hospital Lamoai. She has been involved in treating patients with lymphoedema for post-cancer treatment. Her aim in treating these patients with swelling issues is to help them to achieve lasting functional recovery. Now, I would like to invite Ms. Wong to share on her topic, swelling after cancer surgery. Welcome, Ms. Wong.
Hello, good afternoon. This is Wang Xianfui, and I'm physiotherapist working in Hospital HLWE. I'm today's speaker of this topic, swelling after cancer surgery, which is lymphedema. Today we'll be looking at the overview of the lymphatic system, types of mastectomy, procedures, complications, and also understand what is lymphedema, do and don'ts, and physiotherapy approach. The lymphatic system in our body is the network of tissue to move the excessive colorless fluid called lymph back into our circulation. As we can see the diagram, the red color artery helps to transport the nutrients to the body cell, where the blue color veins help to return the waste product to be filtered by the lymph vessel, which are the green color with the lymph nodes. The function of the lymphatic system is to help to maintain the fluid level in our body, remove the excessive waste products from our body, remove the large molecule of proteins and fats from entering the blood capillary, protect body against the foreign invaders such as bacteria, virus, and fungi, and it plays major role of immune system. This is the enlarged view of the lymph node, where it plays major role in filtering out the proteins and fat from staying in our body. So as we can see in the diagram, there is small lymph node in between the veins and artery to do its job. By nature, lymphatic flow goes in the direction towards heart and neck area, as the process of filtering happens in the center of our body, where the colorless fluid called lymph flow in the direction towards the heart from the capillaries to initial lymph vessel, then to the lymph vessel and lymph nodes, for flowing upwards to lymphatic trunk, lymphatic ducts, and final stop at subclavian veins. So since this is the Pink October month, we will talk about breast cancer. So let's understand what is lymphatic drainage of the breast. It is mainly drained in our armpit, as we can see the direction of the flow to the central breast with 100% of drainage, and more than 95% of the drainage happens at the armpit area, where more than 88% of the drainage will be happening in the central chest, and there is 10 to 50% of drainage happening at the back of our body. As we have seen on the earlier slide of the lymphatic flow, the direction of the flow happens upward from the hand to the armpit. Next, we'll be looking at the types of breast surgery. There are 4 types of surgery. The first one is lumpectomy, which is the removal of the lump. Second is the modified radical mastectomy, which is the removal of some breast tissue with the lump and also lymph node. Third will be mastectomy, which is the removal of the entire breast. Fourth is the axillary lymph nodes dissection with lumpectomy, which is the removal of the lump and the entire lymph nodes from the armpit. It depends on the result of the biopsy whether to do radiotherapy, which is decided by the surgeon. If a patient were to undergo the radiotherapy, she will experience some swelling of the breast, reduced movement of the arm, and shoulder associated with swelling of the arm, which is called lymphedema. The complication of the lymph nodes of the armpit being removed will cause numbness, burning, tingling sensation to the chest wall and arm, gradual tissue hardening around chest and shoulder, followed by swelling of the arm, comes with limitation of the arm and shoulder movement, and also weakness. Lymphedema may develop within days or months, or even after many years. The overall incidence of breast cancer-related lymphedema is reported as ranging from 20 to 53% depending on the number of lymph nodes being removed. In 90% of patients with lymphedema, where the onset occurs within 2 years post-surgery, is normally seen. What is lymphedema? It is the deposition of the excessive protein in the lymph fluid in the body tissue. There is overwhelming lymph flow needed to be drained. by the limited number of lymph nodes causing the abnormal water retention in the tissue. There are 4 stages of lymphedema as we can see in the diagram. There is mild swelling on the hand in stage 1 and 2, but it doesn't affect the daily routine. However, gradual worsening of water retention and protein deposition will happen over time, which cause pain, discomfort to the affected arm, and this will affect the daily routine if the patient does not seek for treatment as soon as possible. Who are at the risk of getting lymphedema? Patient with inflammation of tissue, which is cellulitis, or it could be infection of tissues. Patient with chronic venous insufficiency, which is poor circulation. Patient who is obese and immobile or fully dependent on the assistance, which is called dependency edema. Patient who undergoes traumatized event, could be caused by burn, scarring, post-radiation therapy, or even after some surgery. So physiotherapy is the gold standard of treatment for post-surgical care, especially breast cancer surgery. Patient is expected to experience some feeling of heaviness, tightness, or fullness in the hand, arm, or breast. Patient will feel some skin changing texture or hardening and some redness seen on the skin. Patient will feel some aching, pain, or tension in the hand, arm, or breast associated with less flexibility in the hand or arm. So physiotherapy management, including manual lymphatic drainage, which is MLD, compression bandaging, pressure garment, and exercise. Also, we will look at the skin care. MLD, which is the manual lymphatic drainage, is a light technique where physiotherapists will use own hands to drain the excessive protein deposition with the lymph back to the center of the body to be drained. The purpose is to reduce the load, stimulate the lymphatic function, hence soften the fibrotic induration. This technique can be only done by physiotherapists. Bandaging is another way to control the swelling, and it is applied for the affected arm with severe swelling. This is the pressure garment with thicker material which is able to hold down the swelling and to prevent backflow of the lymph down to the hand. When the patient is referred to physiotherapy by the surgeon, we will ask some medical history and do needful assessment, such as taking arm circumference measurement to compare both sides of the arm, and it is easier for us to set the goals. Diaphragmatic exercise is a comfortable exercise where we take a deep breath in through nose, letting the belly expand, and blow out through mouth fully. Repeat 6 times for 2 to 3 sets. The purpose is to assist transportation of the lymphatic fluid back to the center of body. It is to reduce pain and stress as well. Now coming to exercise part. Patient with lymphedema is advised to do short duration of exercise with minimum 10 minutes, can do 3 sessions in a day, which is morning, afternoon, and evening for 5 days in a week. Then slowly progress to 30 minutes maximum in a day for 5 days in a week. And it is a must to do warm up and cool down before the exercises. The first flexibility exercise is forward wall climbing. So we stand facing the wall, place the palm of the affected hand flat against the wall, slowly slide the hand up as high as we can go until we feel the stretching type of pain, not the exaggerating type of pain. Hold for 6 to 10 seconds, return to the starting position, repeat 5 to 10 times. Second flexibility exercise is the side wall stretch, where we stand with the affected side facing the wall, place the palm of the affected hand against the wall, slowly slide the hand up as high as we can go until we feel the stretching pain. Do not rotate the body towards the wall. Keep the body facing forward even if it means we can't go as high. Hold it for 5 to 10 seconds. Repeat it for 5 to 10 times. Then the third flexibility exercise is the elbow winging, where we do it on our back with the knees bent. Touch the fingertips to the ear with the elbow pointing to the ceiling. Move the elbow apart from the chest until we feel the stretching type of pain. We should not feel extra pain on the chest. Hold this position for 5 to 10 seconds. Return to the starting position. Repeat it for 5 to 10 times. Fourth exercise is the postural correction, where we can do it at anywhere in any position. We can do it in lying, sitting, or standing position by squeezing the upper back together and hold it for 5 to 10 seconds. Repeat it 5 to 10 times. Now, coming to resistance exercise, patient with lymphedema is advised to do light intensity type of resistance exercise. Slowly increase gradually. We can do it at least 2 times in a week. A systematic review, which is the research study, showed that supervised resistance exercise is safe to do and benefit for patients with breast cancer related lymphedema or at risk for breast cancer related lymphedema. This is the first resistance exercise, which is shoulder flexion with dumbbell. We can do it in sitting or standing position. Carry dumbbell with suitable weight. Lift the dumbbell upward to train the shoulder muscle. Hold it for 6 seconds. Then return to the starting position. Repeat it for 5 to 10 times. Second resistance exercise is shoulder abduction with dumbbell. This also can be done in sitting or standing position. Carry dumbbell with suitable weight. Lift as high as we can and hold it for 6 seconds. Repeat it for 5 to 10 times. Third resistance exercise is elbow flexion with dumbbell. This can be done in sitting to train the bicep with pillow supports under the elbow. Flex the elbow as much as we can. Hold it for 6 seconds. Return to the original position. Repeat it for 5 to 10 times. Arm elevation is a must to elevate the affected arm during sleep or sitting or resting position to drain the lymph fluid back to the body by using the gravity force. Patient with lymphedema is advised to do aerobic exercise such as brisk walking, light jogging, cycling, and relaxed swimming to improve the physiological changes in our body. Do not over-exercise ourselves. Do it moderately. Avoid exercise when we have pain or discomfort at the affected arm. Do not do strenuous exercise such as pull-up, push-up, or swimming with quick laps. Avoid extreme temperature with more than 40 degrees Celsius. Avoid standing under hot sun for more than 15 minutes. Try to reduce exposing under the hot sun. Avoid seeking for deep massage therapy for the affected arm, especially with lymphedema, as the outcome may be worsened. And try to avoid tight clothing and jewelry. Do not take blood pressure for the affected arm. Do not carry loads of groceries with the affected arm. Be careful when we have to do the houseworks, which involves repeated movement of the affected arm. Basically, it's the heavy lifting or gardening or sweeping floor, mopping floor. Lastly, do not have the blood taken on the affected arm. Please seek for doctor's advice if you feel extreme pain or discomfort on the affected arm. Thank you for listening. If you have any further inquiries, kindly call to Rehabilitation Center. The number is 04-652-8983. Thank you.
therapy to learn more about the exercise, right?
Yeah.
Without injuring themselves by doing their own exercise.
Yes.
Okay.
That's it.
So yeah, thank you so much for your sharing, Mrs. Wong.
Yep.
Therapy to learn more about the exercise. She have to stop, right? She have to stop. Now, I would like to introduce our second speaker, Miss Yon Pek Ling. Miss Yon graduated from University Science Malaysia with honours degree of Health Science in Dietetics. She is a senior dietitian in Hospital Lamoille and an active member of Malaysian Dietitians Association. Miss Yon has 8 years of experience working as a clinical dietitian. She provides dietary counseling and management to clients with obesity, diabetes, cancer, heart, kidney, and liver diseases. She is also a regular speaker for public and corporate health talks on issues of health, nutrition, and wellness. She actively involved in conducting activities for Hospital Lama's Cancer Support Group. It is now my pleasure to invite Miss Yon Pek Ling to share on the topic of healing diet after breast cancer surgery. Welcome, Miss Yon.
Good afternoon, everyone. Thank you, Ms. Vinu, for your very kind introduction. It's my honor to be invited for sharing today. Well, this is already the last session for the Pink October Virtual Live Talk. So I hope you will stay with me for the next 30 to 40 minutes and I will present to you some useful tips of healing diet after breast cancer surgery. Surgery for breast cancer can be varied. You may have a large wound or just a small wound after the surgery, depend on your condition. One of the reasons of getting good nutrition after surgery is to help with faster wound healing that eventually will reduce the risk of infection and shorten the duration of feeling pain. Most of the time, patients will need to have further treatment after the surgery, for example, chemotherapy or radiotherapy. So, before continuing with further treatment, it's extremely important to load your body with nutrients to prevent malnutrition, as malnutrition can influence the effectiveness of your cancer treatment, your recovery, and quality of life. Patients with malnutrition also tend to have poor prognosis and reduced survival. Malnutrition actually is very common among cancer patients, and one of the reasons is due to cancer itself that increase your body's energy and protein requirement. So, here are the 5 eating tips that I'm going to share with you. First of all, to prevent malnutrition, you will need to increase your protein intake and make sure you are having high calorie or high energy diet after the surgery. You will still require fiber from various vegetables and fruits, but they are naturally low in energy and they create full filling. So gradual intake of fiber will enable you to take more protein and more calories. You will also need to keep your body hydrated because about 60% of our body comprises of water. And lastly, you will need to manage poor appetite to prevent malnutrition. Now, let us go through one by one in more details. So the first one is increased protein intake. Protein is required to build and repair muscles, skin, and other body tissues, especially if you have wound. So protein can help with faster wound healing and reduce the risk of infection. It is also required to prevent muscle loss that will reduce our body strength and eventually reduce your quality of life. Our red blood cell, white blood cell, various hormones and enzymes are also made from protein. Therefore, if protein intake is not enough, it may lead to anemia, lower immune system, and reduced function of hormone and enzyme. Protein can be obtained from animal and plant sources. Animal protein includes meat, poultry such as chicken, egg, fish and shellfish, and also dairy products. While plant protein can be obtained from beans, or various kinds of beans, lentils such as dal, soy products such as tofu and tempeh, and also pea such as green peas and chickpeas. Compared to plant proteins, animal protein contain complete amino acids, which are essential protein that need to be obtained from foods. Therefore, for vegetarian or strict vegan, make sure you are taking various types of beans, lentils, and legume to get all the essential amino acids. There are many diet myths about protein, and I'm sure that you have heard most of it. So the most common one is whether chicken and egg are safe to be taken after surgery. Well, chicken and egg are believed to cause infection and pass on a wound. However, it has not been proved to be true. In fact, chicken and egg are safe to be eaten after surgery as they are good sources of complete amino acid, which is protein, and also rich in iron. But you may want to make sure that they are fully cooked and keep at room temperature for a maximum of 4 hours only after the food is cooked. This is to avoid food poisoning caused by bacteria or parasites. Malaysian likes to have soup after surgery, regardless of the races. Many people think that drinking meat soup, chicken soup, or fish soup is enough to get protein. But in fact, protein does not dissolve in water, even though it has been cooked for long hours. The only thing that goes to the soup is water-soluble vitamin, such as vitamin B and maybe some minerals. So, to get the protein, you must also eat the flesh of meat, chicken or fish. If the flesh is too tough to be chewed, you can make it into minced meat or minced chicken. Their breast cancer patient ever told me that they are avoiding soy products, as there is saying that eating soy food can increase the risk of breast cancer. According to American Cancer Society, traditional soy foods such as tofu appears to be safe as their study shows that it may lower the risk of breast cancer. Therefore, if you are vegetarian or soy product is one of your favorite food, you may take it without hesitation. Despite all the benefits of protein, processed meat and red meat are protein sources among all that need to be limited. Processed meat includes sausage, ham, luncheon meat, smoked bacon, beef jerky, various types of canned meat, and also meat-based sauces. While red meat includes beef, pork, and mutton. The International Agency for Research on Cancer concluded that processed meat is carcinogenic to humans. That means processed meat can cause cancer, and that red meat is probably carcinogenic to humans. Therefore, it is advised to take processed meat and red meat sparingly, if at all. So now we have finished with the protein, and the second nutrition tip is to have high calorie or high energy diet. As I mentioned earlier, high energy and high calorie intake is required after surgery due to increase in requirement and to prevent malnutrition. It can also help for faster recovery as your body would have enough energy for restoration. The main source of energy should come from complex carbohydrate, which is about 50 to 60% of the daily energy requirement, and also healthy fat, which is about 25 to 30% of the daily energy requirement. For complex carbohydrate can be obtained from whole grain such as brown rice, wholemeal bread, oats, sweet corn, pasta, millet, quinoa, sweet potatoes, and so on. The reason we choose complex carbohydrate over refined carbohydrate is due to a higher content of fiber, vitamin, and minerals in the complex carbohydrates. Whereas healthy fat refers to food that contain high amount of unsaturated fatty acids such as olive oil, sunflower oil, various types of nuts and seeds, avocado, and also fatty fish such as salmon, mackerel, sardine, and tuna. Now, I would like to share with you some example of foods that are high in energy and at the same time, they can be high in protein. For example, when you are taking milk, instead of taking plain milk, you can add in some fruits or nuts or seeds and make it into smoothies or milkshake. Instead of taking white bread, you can also make it into egg sandwich, chicken sandwich, or tuna sandwich. If your appetite is low or your intake is very little, you may choose to have some deep fried foods. For example, you can have deep fried potatoes patty, which you can add in chicken instead of meat. Pancake, or more commonly known in Malay is lempeng, is also another very easy to modify foods that we can add in eggs and milk to increase the protein. And if you are craving for some sweet food, you may try barley fuchok, which is a very common dessert among Chinese. Well, I guess some of you may have theory whether sugar is safe to be taken. They are saying that sugar will feed the cancer cell. Is that true? The answer is yes, but it's not all true. But sugar feeds every of the body cell, not only the cancer cell. So it is not true that sugar will directly feed the cancer cell. Anyway, excessive intake of sugar can lead to obesity and increase the risk of cancer. So, intake of sugar up to 10% of daily energy requirement is considered safe. Nevertheless, if your appetite is extremely low after surgery, adding sugar to the foods is a faster and easier way to provide you with energy. After the surgery, some patients will reduce their physical activity and it may eventually lead to constipation. Therefore, eating vegetables and fruits will be helpful. However, fruits and vegetables are naturally low in energy and they create fulfilling. So for patients with low appetite and tend to have early fulfilling, it will be better to first finish the protein food and carbohydrate food to make sure that calorie and protein are taken adequately. Vegetables and fruits can be taken last if you still have space in the stomach to fill up with more food. When taking vegetables and fruits, you may try to choose 5 types of vegetables and fruits with different colors every day. Vegetables and fruits are rich in antioxidants such as carotenoid, vitamin C, vitamin E, anthocyanin, and so on. And all of these can help to protect against damage to the body tissues. Most of the time, patients after surgery will complain of decline in sense of taste and some may have feeling of nausea and vomiting. So, taking plenty of plain water become a challenge to them. However, bear in mind that our body comprises about 60% of water. So, inadequate fluid intake may cause dehydration and higher chance of constipation. If you are unable to take plenty of plain water, you may opt for fluids richer in flavor, such as fresh fruit juice, clear soup, milk, or even formulated clear fluid that contain more nutrients. If you are a fan of coffee or tea, you may need to avoid excessive intake of coffee and strong tea after the surgery, because they do not contain much nutrients and they have diuretic effect, which can cause excessive loss of water through urination. Besides that, alcohol should be avoided totally from your choices, as it does not provide nutrients but increase the risk of cancer progression. But so far, I don't have patient requests for alcohol, and I hope none of them ever. Alright, we have come to the last eating tips, that is to manage poor appetite. In the earlier part, I have mentioned that malnutrition is one of the factors that can affect your recovery and cancer treatment. And most of the time, malnutrition is due to poor appetite or poor oral intake. There are many reasons of poor appetite after surgery. For example, patient may feel extremely tired. They can feel pain at the surgical site. They will have nausea or vomiting due to anesthesia. They will feel worrying with their current health issues or maybe financial issues, and also food restriction due to diet myth. So, all of these will eventually influence your mood and appetite, and therefore causing malnutrition. If patient is able to eat orally, we will encourage eating small and frequent, nutrient-dense meals and snacks, and prefer food with high protein as well. So the picture here is a menu planning that contains 3 main meals and 3 snacks in between main meals. The gap can range between 2 to 3 hours, and the food I suggested are higher in calorie and protein, such as for the breakfast, you can have egg sandwich. You may add in some butter for extra calorie, and also a glass of milk. For the morning tea, you can have muffin and also some fruits. And for lunch, you may have a bowl of fish porridge. Add in some sesame oil for extra calorie, and you can eat it together with the deep fried potato patties. For evening tea, you can have barley fuchok. And for dinner, you can have a plate of fried bee hoon. Add in eggs or fish or chicken for the protein. And last, before you go to sleep, take a glass of milk again. Overall, the food here can achieve up to 1,500 kilocalories and 60 grams of protein, which is already achieved the goal of protein and energy requirement for an adult with about 50 kg after undergo surgery. If your body weight is higher, of course you will need more calorie and protein than what I suggested here. So, please get advice from a dietitian to help with the menu planning that is more suitable for your condition. I encounter that there are many cancer patients tends to prepare food with little oil, such as steaming, boiling, and blanching. Of course, these are healthier cooking method, but we will get bored by eating the food with similar preparation for a period of time, right? So, why not try a variety of cooking method that could increase your appetite, such as roasting or baking, stir-frying or sautéing, stewing or braising, or even pan-frying. The fat we add into the cooking can actually provide extra calorie. You can also use spices and herbs to improve the flavor or mask unpleasant flavor. For example, by adding ginger, garlic, and celery, it will reduce the fishy smell. To improve the taste of oat and bread, you may add in cinnamon powder or black sesame powder. In the condition that you need oral nutrition supplement, you may consider oral nutrition supplement containing immunonutrition. All of the oral nutrition supplements that I show here are high in protein and containing omega-3 fatty acids. There are strong evidence from many studies on omega-3 fatty acids in supporting wound healing and increased immunity among cancer patients. There is also suggestion to take omega-3 fatty acids to improve appetite, food intake, lean body mass, and body weight in cancer patients at risk of malnutrition. For further information, please seek for advice from a dietitian. Alright, so here are all my references. With that, we have come to the end of my sharing today. Thank you very much for joining.
Thank you for that great informative sharing, Miss Yon. First of all, I would like to apologize for the audience, so for the technical error that occurs earlier. So I would like to repeat the session, Q&A session with physiotherapists again. I'm sorry, Miss Wong, for the technical error.
No problem.
Okay. So may I know what kind of exercise that you would suggest for those patients who underwent surgery?
Alright, so firstly, I would like to advise patient to try doing deep breathing exercise, which is the diaphragmatic breathing, as I mentioned earlier. That is to control the pain. Secondly, is to do arm elevation with 2 pillows. That is to control the swelling. Thirdly, usually when doctor refer patient to physiotherapy, we would do necessary assessment and decide which exercise to start. So maybe we will bring patient to walk in the room first. That is to maintain the physical activity of the whole body. Then, depending on the scar healing, if the patient's scar healing is catching up within 3 to 7 days, I would let patient to try to do the arm raising exercise, simple way, and to do elbow flexion extension exercise and also hand gripping, mainly to maintain the movement of the arm. Patient can do it 10 times for 3 times in a day, then slowly progress to maybe 20-30 times in a day. Then that is also depends on physio advice. Thank you.
Thank you, Ms. Wong, for your comprehensive answer. Now, we would continue with the Q&A session with Ms. Yon. Now, I would like to introduce our... Hi, Ms. Yon. Sorry for the technical error. So, we would like to continue with our Q&A session. Okay, Ms. Yon, in your talk just now, you mentioned that it is not encouraged for the patient to take excessive tea and coffee. What about the coffee or tea lover? If they want to still have their coffee or tea, how much would you recommend so that it is not excessive?
Alright, thank you for the question, Ms. Vino. For patients who would like to have coffee or tea after the surgery, I would suggest maybe only 1 to 2 cups a day. With or without sugar is not a big problem, but would suggest not to add creamer inside. But naturally, black coffee or plain tea, they contain very little of nutrients. So for people with low appetite after surgery, I would suggest maybe can opt for oral nutrition supplement, which contain coffee flavor or tea flavor, because at the time you enjoy the taste that you like, you can also obtain more calories, more protein, and more other nutrients for the recovery.
Okay, thank you for your answer. Uh, I think Miss Yon, you have heard about detox diet. So
Yes.
nowadays, most of them claiming that they are only drinking juice for 1 or more days, saying that they can remove all the toxin. So what is your thought about this, Miss Yon?
Okay, well, detox diet is always a hot topic when we talk about preventing cancer. But actually, this detox diet is a fat diet or um, diet myth because there is actually no scientific evidence to support the claim that drinking fruit juice or vegetable juice, as suggested in detox diet, can help to remove the toxin from our body. Well, in fact, when toxin enter into our body, maybe from our foods or beverages, it will remove by our liver or kidney in everyday basis, and it's actually our body's regular function. And our body do not require any juices to help carry out that function. So, but for people with poor appetite after surgery, fruit juice can be an option to increase their fluid intake, as I recommended in the talk just now. But then I would suggest the fruit juice is only part of your fluid and not drinking fruit juice for the whole day, because fruit juice can also be high in sugar, and it will cause more complication, especially for people with diabetes, as it can spike up your blood sugar, and eventually it delay wound healing and increase the risk of infection.
Okay, thank you for that very comprehensive answer. Okay, I think most of the myth was debunked by our dietitian, Miss Yon. So for those who are seeking dietary advice, you may come and make an appointment with our Hospital Lama dietitian for more information and more individualized counseling. So I think with that we would like to end our session. Thank you for your participation, and thank you for your time. I hope this session benefits most of us. Thank you, and see you again with our next live talk. Thank you.
Thank you.
Good afternoon, ladies and gentlemen. Thank you for being here with us